Welcome to the Clearmate Setup and Operation Training video. Clearmate is a volatile agent washout system intended to accelerate the elimination of volatile hydrocarbons such as carbon monoxide, ethanol, and anesthetic gases from the blood. Treatment with Clearmate must be performed by a physician, anesthesiologist, or emergency medical technician in an emergency department, operating room, ambulance, or at the scene of emergency. In this video, you will learn the basic steps to help you set up and operate Clearmate. This video is not intended to replace the Clearmate operator's manual, which must be read by anyone intending to operate the device. System components. Clearmate was designed to provide immediate treatment and can support both spontaneously breathing and non-spontaneously breathing patients. The system comes with the Clearmate device and the required hoses for connection to a high-pressure oxygen and high-pressure carbon dioxide source. In order to operate the device, you will need the source gas connection hoses, a high-pressure 100% oxygen source, a high-pressure 100% carbon dioxide source, and a breathing circuit for either spontaneously breathing patients or non-spontaneously breathing patients. On the face of the device, you will find the following components: the carbon dioxide gas on-off switch, the carbon dioxide gas pressure gauge, the oxygen gas pressure gauge, the oxygen flow control knob, and the airway pressure gauge. On the right side of the device, you will find the 100% carbon dioxide gas inlet and the 100% oxygen gas inlet. At the front end of the device, towards the left side, you'll find the airway pressure sensor line inlet for use with the non-spontaneous breathing circuit, the oxygen flow outlet port, and the demand valve outlet port. Setting up Clearmate for use. Begin by firmly mounting the Clearmate onto a Clearmate stand or place it securely onto a flat, hard surface. Connect one end of the oxygen hose to the oxygen inlet fitting on the right side of Clearmate. Connect the other end to a clean, dry, medical-grade oxygen supply. Turn on the oxygen supply. Ensure the supply is delivering oxygen at a pressure between 47 and 95 psi. Connect one end of the carbon dioxide hose to the carbon dioxide inlet fitting on the right side of Clearmate. Connect the other end to a 100% carbon dioxide source. Do not turn on the carbon dioxide at this time. Using the oxygen flow control knob, set the oxygen flow to match the patient's estimated resting minute ventilation, based on their lean body weight as indicated on the device label. Refer to the operator's manual for guidance on oxygen flow settings. Press in the carbon dioxide gas on-off switch and turn it clockwise to the on position. Turn on the carbon dioxide supply. Ensure that the supply is delivering carbon dioxide at a pressure between 35 and 95 psi. Connecting a breathing circuit. For a non-spontaneously breathing patient, first attach the oxygen tubing on the circuit to the oxygen flow outlet port on the front of Clearmate. Connect 22 mm corrugated tubing to the demand valve outlet port. Attach the airway pressure sensor line to the airway pressure sensor inlet. Connect carbon dioxide monitoring equipment to the circuit in a side stream or inline configuration for the measurement of expiratory carbon dioxide concentration. Using the self-inflating bag, manually ventilate the patient. If the patient's ventilation rate can be safely increased, hyperventilating will increase the rate of elimination of the volatile hydrocarbon. For a spontaneously breathing patient, first attach the oxygen tubing on the circuit to the oxygen flow outlet port on the front of Clearmate. Connect 22 mm corrugated tubing to the demand valve outlet port. Ensure that the mask is occlusive and has a tight seal on the patient's face to prevent leaks. If the patient is awake and cooperative, advise the patient to hyperventilate by taking deeper breaths at a higher frequency. Carbon dioxide monitoring is not required for a spontaneously breathing patient, but is recommended. Safe hyperventilation is supported by Clearmate via isocapnic hyperpnea. The Clearmate maintains a constant partial pressure of carbon dioxide while enabling increased minute ventilation. This procedure augments the washout of volatile toxic agents such as carbon monoxide. Patient blood gas measurements of carbon monoxide or carboxyhemoglobin will indicate the duration of treatment. In the absence of such data, the half-time elimination of carbon monoxide with isocapnic hyperpnea is approximately 30 minutes. The first 30 minutes of treatment is the most effective in carbon monoxide elimination. However, the duration of treatment may be prolonged to support additional elimination. System alarms. The Clearmate has built-in safety features that will protect the patient against the loss of oxygen supply while carbon dioxide is pressurizing the system. The system will alarm if the oxygen supply fails and pressure drops below 40 pounds per square inch in gauge, or 2.75 bar, with or without the carbon dioxide source attached. If the carbon dioxide supply fails or is exhausted, no alarm will sound and Clearmate will continue delivering oxygen to the patient. The alarm is completely pneumatic, driven by the gas supply, and therefore the volume cannot be adjusted. The alarm will reset once the alarm condition no longer exists.